What is chronic obstructive pulmonary disease or COPD? Chronic obstructive pulmonary disease refers to a collection of chronic lung conditions that limit the airways and cause difficulties with breathing. Smoking is the most common cause. The conditions that make up chronic obstructive pulmonary disorder or COPD usually include chronic bronchitis and emphysema. In the United States, 6.4% of people have a COPD diagnosis. Half of the people with breathing difficulties remain undiagnosed, and the figure may be higher. What is COPD? COPD is a lifelong incurable respiratory disease. It includes two main conditions: emphysema, in which the air sacs of the lungs are damaged, causing the lungs to lose their elastic nature, so the lungs become floppy. This decreases the lungs' efficiency in exchanging gas. Chronic bronchitis, a chronic inflammation of the airway lining that causes a thickening and increased production of mucus. Bronchitis becomes chronic when it persists and resists treatment. Many people with COPD will have both of these, but the severity of each varies between individuals. Asthma symptoms may overlap as a part of COPD, and a history of asthma can increase the risk of developing the condition. Asthma refers to inflamed airways that spasm and overreact to inhaled substances. The breathing difficulties and airway obstruction worsen over time. COPD is the third leading cause of death in the United States. A person with advanced COPD may be unable to climb the stairs or cook, and they may need breathing assistance with medications and oxygen. Symptoms: COPD produces some or all of the following symptoms: chronic and deteriorating breathlessness, especially after exertion; persistent cough; excessive production of sputum; fatigue; wheezing; frequent respiratory infections. In more severe cases, there may be a blue tint of the lips or fingernail beds; shortness of breath while talking; lack of mental alertness; rapid heartbeat. People with mild symptoms may not seek help. The United States Department of Health and Human Services estimate that 12 million Americans have undiagnosed COPD. Complications can include recurrent respiratory infections such as pneumonia, heart problems, lung cancer, high blood pressure in the lung arteries, depression due to the inability to lead an active lifestyle, weight loss, malnutrition. These complications can be fatal. It is best to take preventive measures against them on receiving a COPD diagnosis. For those who smoke, quitting is essential. Continuing to smoke will worsen symptoms. Causes: smoking is the main cause and risk factor of COPD in the United States, and about 8 out of 10 COPD-linked deaths are in smokers. Risk factors: apart from smoking, risk factors that increase the chance of developing COPD include the burning of wood and biomass fuels indoors; genetic factors such as a deficiency of alpha-1 antitrypsin, an important lung protectant produced by the liver; exposure to air pollutants and toxins at home and in the workplace; poor indoor air quality; family history of COPD. Around 1 in 4 people who develop it in the United States have never smoked tobacco. Most people with COPD are over 40 years old when symptoms emerge. However, it may start at a younger age in a person with an underlying health issue such as alpha-1 antitrypsin deficiency or a history of respiratory infection as a child. Diagnosis. For a diagnosis of COPD, the symptoms must persist or deteriorate. If a person has the same symptoms but the symptoms go away, they may have another condition. A doctor will ask about family and medical histories and any history of smoking. A lung function test called spirometry can confirm a diagnosis. This measures the amount of air given out in a short breath and the speed of the air flows as this breath happens. The patient blows hard into a tube attached to the spirometer, which provides the readings. This test measures how well the lungs work on a variety of levels. Other lung function tests are available if spirometry proves inconclusive, such as a lung diffusion capacity test. Blood tests and images of the chest with X-ray or CT scan can also be useful. Life expectancy of a person with COPD depends largely on whether or not they smoke and how severe their lung damage is once diagnosed. Non-smokers with COPD or people with less severe symptoms are less likely to lose significant years from their life. Smokers at an enhanced stage of COPD, however, lose around 6 years of life expectancy, apart from the 4 years that smoking itself takes off. COPD is irreversible, but smokers can reduce their risk by quitting as soon as possible.